How you doing, guys? So this is Dr. Sa at Specific Chiropractic. We got a special guest over here. So in this video, we're going to talk about how we're going to deal with this gentleman's the deviated septum, the shoulder problems from all that martial arts and everything else going on, right? And the more lately thing you're coming in here for is the low back pain, sciatica, with numbness going to the front of your thigh, and also numbness. Let's point out over here. What total was that? Was it between the third and the fourth? Numbness over there. His other thing I forgot to mention during the consultation. Okay, so we're talking about you've also been having some vision problems as well, right? And also ringing the ear after you had a Y strap so-called adjustment where the guy like yanked your head real hard. Okay, so that hasn't gone away for
a while now.
A year. Okay. So now we're going to piece some other stuff along with the other history, such as sciatica, the shoulder problems, so on and so forth. So the vision issues and tinnitus, well, we can see over here, okay, this is degenerated and also very posterior on that fifth cervical. This particular nerve, that fifth cervical nerve, is actually deal with the auditory part and also the vision as well. Okay. So we're going to take a closer look, see what's going on, and confirm whether that's an issue, okay? In addition to, because the way it's rotated over to the right, it is dealing with that anteriorly with that atlas. So we'll knock out two birds, one stone, and shall clear the sinuses a bit more. But also going down, now we've got the shoulders. So that fifth cervical nerve also deals with the thyroid, the shoulders over here, but we also got all this still. We've got this side and also all the rotation over here. But when we keep on going down even further, we see all this flowing degenerative joint disease going on, all this arthritis here, but nothing on the left-hand side. So that's usually an indication of an external rotation of the hip of the opposite side. So if I'm seeing on the right side, there should be an EX, ilium, on the left-hand side over here. Okay. But what's curious about this case here is the fact that, well, with the gluteal full line, there's a little bulge to the right and a smack in the middle. So that tells me, says, wait a second. This line should be way off to the left, but no, it's smack in the middle. Where's the external rotation? So do a little more compass, we do some more measurements. If we do the measurements over here, this is narrow, this is wider. That confirms, no, this really is the external rotated hip on this one, okay? But when we take an even closer look and break it down even further, well, the pelvis is tilting down this way. Okay, not a whole lot, but it's still tilting downwards, sinking down on this right-hand side. So when it's sinking down this side over here, okay, textbook tells us there should be a PI, EX, or PX misalignment on here, or a short leg, an anatomically short leg on this right side. So if there is a PI, EX, or PI, EX, when we address and adjust this hip, it should level it out. But since this is taller on here, if we adjust the EX, it's going to make it even more lopsided that way. Yeah, that's what makes things interesting. So on here with this one, we have an ASIN ilium. So if we do adjust this one, it's going to tilt it even more this way. Now the reason why it became this way, and that's how we pretty much figure out biomechanically, you have the anatomical short leg on the right hand side, is because if you're short on the right leg over here, okay, how do we put a heel lift? How can we raise the leg back up? So biomechanically speaking, what your body did was, the anatomical biomechanical rules is this: the hip, when it starts to go into anterior superior direction, as in it's tilting this way, what it does is it makes the leg longer, but it can only compensate to a certain degree. So therefore, when this leg starts to become shorter while you're growing up, your body was trying to adapt and try to push it this way. But it's not just this way over here, because this over here, they're both connected. So when this, on this right side over here, tilts forward this direction, your left hip goes opposite direction. And if this one, since it's going into internal direction over here, your left goes external rotation. Exactly. So therefore your body was doing this external rotation for so long. That's how it's become arthritic over here. You got it. Because think about it this way: if you're over here, we can't stay this direction. Our head has to be here. So to compensate, that's what we're seeing the middle of your spine over here. Twisting a lot to accommodate for that rotational torque over there. Right? So that's what's coming from that area. Now, however, because it's been there for so long and it started to become arthritic, then we start to develop some compensations, because from here, it starts to become like this.
Right.
So this one over here becomes the first compensation. Problem is, this locks up. And then from here to here, then we start developing another twist right there. This starts locking up. This starts locking up. And we start locking up even here, not a lock up. That's where we see a lot of degenerative joint disease right there, that third lumbar.
Yeah.
All right? So therefore, this is going to be an interesting one, because that fellow over there wore out due to the hips becoming unstable. So since both hips are starting to lock up, this fellow over here, the fifth lumbar vertebra over here, there's supposed to be some movement over here. No, it's hard to compensate and wiggle even more because both hips locked up. All right? So it's not designed to move this much. So once you start moving out this much, what's going to happen at this?
It wears out, yeah.
It's going to wear out. So that's why it became so thin over here.
Yeah.
And then this starts to lock up a bit. And the problem is the one right above it has no choice but to move even more to compensate for that one. That's why that became swollen. But we're also dealing with that headache. So that's also locking up. So that's why this is moving even more in an attempt to do so, compensate for that third lumbar deviated. So that's what makes this case very challenging on how we're going to peel things off. We're going to do the top layer first and then deal with the underlying layers later on. So most likely, and I wouldn't be surprised me that this left EX is something we need to adjust first, and then the future visits, we're going to tackle that ASIN and then put a medial heel lift right behind it. Okay, so we can start rebalancing off.
Lift up, yeah.
You got it. And then, but after I adjust this one, no, that fifth lumbar, I need to adjust that right away, because it wouldn't surprise me. There's sciatica and the numbness down your left leg is coming from that, and the anterior thigh.
Yeah.
Okay, that pain is coming from here, from that fourth lumbar, and part of that third lumbar as well. Okay, so that's what the strategy is going to be for this fellow over here. Tackle, unwind all that mess, and this fellow over here, and this is for your shoulders. Now, visualization, we can see right here. Okay, so we got some muscle spasms, so swelling up here, especially down here. Quite a bit of swelling over here. Okay, so this is a long-standing degenerative DAD going on here. That's why this is not as swollen over here. It's chronic edema right there. And we see over here, so that's one of the surprise me, that's between third and fourth lumbar. That's swelling edema here, and a swollen edema here, and then a swollen edema over here. So with this instrumentation over here is just simply just identifying some key areas we're going to take a closer look at to confirm. Tender right here?
A little bit.
A little bit. How's this fellow right here?
Yeah. Same.
All right.
Right there.
Yeah. Okay. Wow. All right. That EX ilium is really a brick wall in there. That's not moving. See, that's moving just fine. See, that's stuck right there. Yes. See, that's moving decently. So this confirms biomechanically what I'm already expecting, is that, okay, the body compensates for a short leg on the right side by making this AS, and then we got this external rotation over here. Let's check on the sacral segments. Decent, not too bad. How's this fellow right there?
I can feel that a little to the left, yeah.
A little bit, right? So slightly. Now how's this fellow right there?
Yeah, same thing, going to the left. Yeah, right there. Right, yeah.
So that's that. So you're saying to the left, we're turning down to your left leg, sir?
Yeah.
So that confirms that left sciatica, that fifth lumbar right there.
Mm-hmm.
Yeah, see that's not hunky-dory fine there either. How's this fella right there?
There's a okay. Again, it still goes. You feel it coming out that way.
Gotcha. How about this fellow right there?
It feels okay.
It's all locked up.
Yeah.
Not too great right there. How's that fellow right there?
Feels okay.
How's that fellow right there?
Feels slightly tender.
Yeah, that fits cervical. It's not moving. It's a brick wall. There you go. There it is. Okay, walk around. Yeah. Tell me, sir, what's different in there?
Feels looser. Feels straighter.
How's the sciatica going on your left leg?
Don't feel it. There's no that nagging something going down the leg. It feels, yeah.
What about your toes?
Feeling is going back. Yeah.
So the numbness starts to dissipate?
Yeah.
Nice.
Very nice.
That's what we're talking about, brother.
Yeah.
Here we go.
Feeling going down both legs as opposed to, feeling just one side versus the other. I can feel electricity going down, like as if something has been unlocked.
Good. As long as you feel like more power going down there. Huh?
Yeah.
Nice. How's the sciatica doing right now?
Oh, this is great. This is great. Again, feeling is going back to left leg and left side. Feels good. That's good. Again, I think I'm standing straighter. I can straighten that as opposed to being a certain angle.
All right. What does dorsal look like to you? PLS?
Yes, actually feel there's wedges on the right.
Yeah, but I'm actually thinking about just tilting more this way. Because that's the way you adjust it. Tilt this way, this one down this way. So this, the left dorsal should change a little bit.
Actions appear.
Yeah, you should tilt a little more this way after all that. Let it go, a little more. Okay, we're gonna pump this up because it's kind of arthritic. There it is. Now we're gonna check everything else. Okay, so no, just relax. SC's moving fine. AC's a bit locked. The scapula is not moving. So we have an anterior EX, so AEX humerus, that's locked. Check this one. SC's moving fine. AC somewhat decent. Scapula is slightly locked. Yeah. Oh, mild AEX humerus on this one. Okay. See, this is completely locked up. Pump this up before we set it. Good. This is also slightly locked. Yep. A little more. There it is. There's that one. Okay, walk around, sir.
Yeah.
Do you like that fella?
It's good. It feels more normal, as if the weight has been lifted, and not protecting whatever joint, whatnot, it feels looser,
How's the shoulders feeling?
It's great. No cracking. See, this, I would have heard clicking and cracking and whatnot. Nothing. Silence.
Nice.
Yeah.
A little more. Good.
This side, a lot. I used to be locked. I couldn't do this without tenderness and pain. Much better.
Good. How's the ringing in the ears, sir?
No ringing. Silence. Silence in the ears.
Nice.
Yeah.
How's the vision?
Good. Good. Much better. Much better.
Tell me how the vision is. How much further compared to your usual to now?
Yeah, I'd say at least 30% better, at least.
What about this? This is even smaller.
No, this is great. I can see everything without having to do this. Much better, much better.
Nice.
Yeah.
How much better would you say for your vision now?
Oh, 60% at least, yeah.
Good. So that's what it comes down to. You just need more nerve function.
Yeah.
Okay. So applying from your neck into your sides.
Yeah.
Right? Which nose you have the most trouble breathing with?
Right side, because left is easy.
Yeah, see, it's not moving here at all. Let it go. There's one piece. I gotta get the nasal bone in place. A little more. There it is. I gotta still get a little more. Get a little more deeper in there. Good. Maxillary sinuses are clogged. There's that big clunker. This left frontal sinus is clogged. A little more. Good. This spheno is slightly stuck. Okay, sir, come on up. Good. Now try it. Let's show the viewers over here.
Oh my. At least 50% better. Yeah.
All right.
Yeah.
Okay, go ahead. Blow your nose out. Clear that out. Get your trash can.
Very much the same.
Okay, sir. Okay, now give that a try. See how your nose is.
Easy. Same. Very much the same. I can breathe.
Nice.
Hallelujah. Thank you.
Oh, hey, not a problem. Okay, so now bear this in mind, okay?
Yeah.
Because all your left sinuses are all clogged up, all right? You may experience three things. Either you're gonna feel like a huge drainage coming out
Okay.
there, or it feels like a slight little post-nasal drip, so that it feels like something's tickling down the
Your
back of your throat. Yeah. Or it feels like you feel like something you don't want to cough out, but nothing coming out there.
Okay.
That's gonna last for the next 36 to 48 hours. Give it some time. If you want to speed it up, I recommend get a steam bath and try to breathe the vapors in. Try to drain all that junk out of you.
Yeah.
All right?
Awesome.
Okay.
Awesome. Thank
All
you.
right, sir. Well set.
Thank you.
Oh, you're very welcome.
Thank you.
All right, give us the latest updates. How's everything come along?
Good, really good. Back feels great. Again, when I stand up in the morning out of bed or stand up out of the chair, I feel great. There's no tightness, no pain. I don't feel like an 85-year-old where I need like 5 minutes just to kind of warm up and walk around. There's a slight humming in the ears, I think probably because I'm not sleeping properly. I wake up middle of the night, my neck is slightly bothersome, and last week when I was working out, I was doing behind the neck presses. I think they kind of...
May have aggravated.
Just a touch, yeah. I didn't feel it that day, that night, but the next day when I started feeling it again. So maybe that's something I'll avoid doing in the future, I think.
How's your vision?
Good. Much better than last time. It's clearer. I mean, I still need glasses when I read, when I do the computer work, but it's much clearer.
All right.
Yeah.
I'm glad all that turned out for you.
Absolutely,
Okay.
absolutely.
All right, so thank you for the updates.
Absolutely, it's my pleasure.